You go to sleep somewhere around 23 hours and generally get a decent sleep, but then such an unexpected punch, more or less clear head, you think it might already be morning. You look at the clock, at the smartphone, and it's 3 o'clock at night. Moreover, after this, there begins such a perhaps hard to stop flow of thoughts, mostly negative thoughts, and you think, my God, what kind of nonsense is getting into my head? And you can't stop this flow of thoughts. And you're already tired of thinking, but then the alarm rings and it's time to get up. You wake up in the morning shattered, exhausted, without mood. Somehow you cheer up, live, work, but the evening comes, night, and everything repeats again. So let's talk about early awakenings with the inability to fall asleep again. If you watch this video to the end, you will find out why this happens, and most importantly, what to do about it and how, in general, you can effectively deal with it. I'm Roman Buzanov, a sleep doctor and a professor with a doctorate in medical sciences, distinguished doctor of Russia. For over 30 years, I have been diagnosing and treating sleep disorders. Why do we experience early awakenings with the inability to fall back asleep? For this, we need to delve a little into physiology, and then it will be clearer why everything happens this way. I'll start, perhaps, with such a slightly strange experiment. When we, in the first year of the Institute, took a frog and lowered its paw into an increasing concentration of sulfuric acid. At first, this paw began to twitch more strongly, and after some time, it stopped twitching altogether. And this first reflex, when it twitched more strongly, was the equivalent of a pain reaction. That is, the frog actually reacted more actively to some external irritant, but then the paw stopped twitching altogether. The thing is, if the frog's brain could no longer cope with the flow of pain impulses from the extremity, it could switch off the peripheral receptors, and the brain simply stops perceiving this pain. That is, it decides that I just can't cope with this and switches off these pain receptors. This is called a suppression reaction or a depressive reaction. In fact, a similar situation develops in a person. As a rule, early awakening with the impossibility of falling asleep again is a sign of a chronic, lingering stress situation with which the brain has not coped in one way or another, and at some stage a depressive reaction has developed. I will now tell you how everything happens in a person. In fact, if we talk about the beginning of stress, then, as a rule, there is also such a distressing component. That is, a person reacts more actively. He gets nervous, he makes some efforts to cope with this stress. By the way, anxiety causes neurosis. This usually leads to problems with sleep. But if a person has already fallen asleep at some stage, then he, in principle, sleeps until morning and more or less normally gets enough sleep. But if the dragging stress continues, and the person especially does not see a way out of this stress in some foreseeable future, at some stage the person's brain, just like the brain of a slug, says, "So, I'm sorry, I'm fed up." And the brain begins to turn off the channels of incoming information. That is, memory specifically decreases. That is, the person stops. The brain stops wanting to remember something. It's not actual memory loss, such as dementia, typically assumed in the elderly. It's just that the brain doesn't want to remember anything. Specifically, feelings and emotions are reduced, such an apathetic abolic syndrome, when neither positive nor negative, everything becomes somewhat dull. A person loses a sense of perspective, that is, the brain is in such a cocoon and he doesn't want anything. And during the day, he tries to isolate himself from any information that can irritate him. But when our bark slows down and the cortex unravels at night, and especially towards the second half of the night, when we have more so-called rapid eye movement sleep, when the brain processes information accumulated during the day, plus what it has in long-term memory, and the brain has to make some decisions based on this situation. Think about how to act further, adapt to the environment, and form long-term memory. And if a person's stress has already become too much, then the brain turns to this situation, but especially if it's endless stress, and it doesn't understand what to do with it. He can't calm down, he can't forget, he can't understand how to form some kind of reflex or long-term memory, how to live with this, to put it bluntly. He gets overexcited, more adrenaline, cortisol, and at this moment, there is such a sudden awakening of the brain, moreover, with a hard-to-stop flow of thoughts. Essentially, the brain starts contemplating at night what it didn't during the day. And then, having thought something like this by morning, a person naturally gets tired. He didn't sleep, he didn't get enough sleep, plus a loaded brain. This processing of information, both in sleep and then such a semi-conscious, semi-unconscious, such a sleep or half-dream. And naturally, a person wakes up again without any mood, in a slump of strength, and so on and so forth. That is, in general, this is a characteristic symptom of a developing depressive state. Moreover, this is what we call reactive depression. We have psychiatric depressions within the framework of bipolar disorder, recurrent depression, and there is as a reaction to pressure or a depressive reaction of the nervous system in response to chronic stress. While the symptoms are, in principle, practically the same, although I want to say, as a rule, endogenous depressions, they are somewhat more severe. There are often suicidal thoughts, suicide attempts. Here, the situation rarely reaches such a severe state, but actually, the person still continues to suffer. Moreover, the arising chronic sleep disorders become a stress situation in themselves. The person sees no way out of this, and the sleep disorder itself also becomes depressive. That is, there arises a kind of snowball effect, a vicious circle, when stress triggers sleep disorders, and sleep disorders further intensify stress and cause, in fact, ongoing sleep disorders. Such an unpleasant situation. What can be done about this? Well, in fact, if you go to a doctor with such complaints, in 95% of cases, you will be diagnosed with depression and prescribed antidepressants. And generally speaking, I want to say that to a certain extent, this is a possible way out of the situation, in the sense that they allow to remove depressive symptoms, stabilize the nervous system, and do not allow the situation to progress further. But at the same time, a question arises. This is not some kind of psychiatric situation. This is the body's reaction to chronic stress. And here there may be several options. The first is when you just look at your life and think about what can be changed to remove this chronic stress that led to this depressive state. Well, I don't know. The boss is grumbling. Yes, and you choose to switch jobs. Or, say, there are some toxic relationships between people, and you just decide that these relationships are no longer needed. And sometimes just ending a certain ongoing stressful situation leads to the fact that after a sufficiently noticeable period of time, a month, 2, 3, sleep also begins to improve. And in general, the mood begins to improve because you have resolved the stressful situation itself. And the next possible option, if we still tend to not prescribe drugs, is the use of so-called cognitive behavioral therapy for stress, anxiety, depression, and insomnia, which, so to speak, is also present in this case. And in this sense, I want to show you, here you see on the screen the book, The Foreseen Calm. This is a book that we wrote together with my colleague, Sofia Cherkasova. And essentially, it's a textbook or even a self-study guide on the technology of foreseen calmness. This is a new theory and practice that has been developing around the world for the last 3-4 years, which teaches a person to better cope with stress. The technology itself assumes that we apply various relaxation techniques throughout the day, teaching a person to periodically exit stressful situations, even if he doesn't realize he's in one. These are breathing techniques, mindfulness, for example. During meals, during physical exertion, it's working with life imagery. It's working with thought. It's work. As there is such a chapter in the book, How to Turn an Elephant into a Fly. We often amplify small issues into big ones, causing us to worry and get upset. And there are techniques that allow you to turn an elephant into a fly. That is, on the one hand, these are behavioral techniques. On the other hand, cognitive techniques. I will say that in addition to this program, I also implement a cognitive behavioral therapy program for insomnia. And on this note, you see another book on the screen. It's called How to Beat Insomnia, Healthy Sleep in 6 Weeks. My colleague Sofia Cherkasova and I wrote it, by the way. And this is already the situation when a person has developed chronic insomnia. Because somewhere around 3 months of a chronic situation that really disrupted sleep, a person develops conditioned reflexes of fear of not falling asleep, bed insomnia, negative thinking and forecasting, maladaptive behavior. That is, a person begins to try to get lying down earlier, getting up later, trying to sleep during the day. Moreover, he makes a series of logical mistakes which further push the person, if I may say so, into insomnia. And again, more than 3 months later, it doesn't matter what caused the insomnia. We can already get anxiety, we can get stress, we can cure depression, but insomnia itself will remain because the so-called conditioned reflex insomnia, which has taken hold against the background of fruitless attempts to sleep, will remain. And in this sense, cognitive behavioral therapy for insomnia is already being used, although relaxation techniques are also successfully used as part of this program. But there are also added techniques of sleep restriction, irritant control, because the most effective technique for treating insomnia, strangely enough, is the technique of treating with sleep restriction or bed stay time. Well, in general, if you have such chronic insomnia, chronic stress, please turn to us. In the description to this video, first of all, you will find links to these remarkable books. You can buy them in bookstores or on marketplaces. Well, if you have a serious enough problem, turn to us for consultation, and we can effectively help with stress, anxiety, depression, and insomnia, implementing programs of premeditated tranquility, or implementing a treatment program for insomnia using the so-called method of cognitive behavioral therapy for insomnia. And in fact, if we increase the stress resistance of the nervous system, if a person starts to worry less, he has fewer negative thoughts during the day, he is less stressed, and the nervous system becomes much more stable, then gradually these night awakenings, they start to drift further towards the morning. This, incidentally, indicates the start of a person's recovery, so to speak. Suppose he wakes up at 3 a.m. as his nervous system stabilizes. He starts waking up at 4, then 5, and finally at 6. There is no instantaneous result here. Usually it takes several weeks or even months for such a, perhaps training, if you can put it that way, process of stabilizing the nervous system. But this is a very effective technique and methodology that allows you to cope with these early awakenings without the use of antidepressants. On the other hand, a combination of cognitive behavioral therapy and antidepressant treatment is possible. The only thing that's important to understand is that if we prescribe antidepressants, then when I prescribe antidepressants, I think first and foremost about when I will cancel them. Yes, we can stabilize the nervous system. Yes, we can get a good effect in, let's say, 6, 8 months, 12 months, a person takes antidepressants. Everything will be fine. But then if we cancel them and the person has not changed anything in his life, that is, he has not removed the stressful situation, he has not increased the tolerance of stress loads, let's say, he has not increased stress resistance, then canceling antidepressants and the original predisposing factors remained. Literally the slightest additional provoking factor. There is a relapse right here. And, unfortunately, the likelihood of a recurrence of the same reactive depression or insomnia against the background of a continuing stressful situation, if a person has not made any efforts to stabilize the nervous system, is almost 80% per year, which requires the represcription of antidepressants. So if we still talk about cognitive behavioral approaches to the treatment of stress, anxiety, depression, and insomnia, they are practically as effective as antidepressants on the one hand. But in the long term, the risk of relapse is much less if we have effectively dealt with this situation using cognitive behavioral approaches, not antidepressants. In general, I hope you now understand why early awakenings occur, and most importantly, how you can effectively deal with them. And you can do this independently, practically using our textbooks, such as How to Overcome Insomnia or Premature Peace. But you can, please, come to us for a consultation. We will assess the situation, and we can conduct these trainings ourselves, practically such in the form of online programs, if I may say so, of healthy sleep and quality of life and anti-stress. But I want to emphasize once again that in most cases, it is with cognitive behavioral approaches that we manage to cope, to cure a person from stress, anxiety, depression, and insomnia, even without resorting to antidepressants. Good luck to everyone and have a good sleep.